I shared a case. I shared a case on I think my WhatsApp group. A very beautiful case, which I cured of my friend who was living in Pune. A case of arthritis, a reactive arthritis case. Since 1 year, he had a problem. She had a problem in knee. There was a lot of swelling. Aspiration was done. Antibiotic was given. Then the doctors told to the arthroscopy and what not all. But he did not want to go for surgery, so he contacted me. And after that, you know the history, what happened, and then we have taken the whole history. One dose I gave in the night and one dose in the morning, and immediately the patient says that I need to stop the antibiotics. And the patient told there was no fever, the swelling came down, and the patient started walking within 2 days. So this is how that case basically worked for me in the favor of homeopathy, because he never believed homeopathy, but with that dose, he always writes to me, what was that magical dose? So welcome Dr. Palak, Dr. Vishal, Dr. Pranam, Dr. Anja. So this is what homeopathy I wanted to tell you today. And welcome Dr. Meera. So I hope everybody must have read that case, whoever is in my WhatsApp group. Which remedy do you find must have been given to that case? Just 2 doses of the medicine, and the case was absolutely through within not even it took 24 hours for the medicines to work. If I ask the question, which remedy you thought was given to that patient? Anybody? We'll discuss that, maybe the remedy also. But can you get some remedy? It was a case taking done by me, and the whole case has been sent to you. So what do you think about the case, and which remedy do you think which might have been given in that case? Anybody? I hope everybody has seen that case. Yeah. Dr. Good afternoon, Dr. Vishaka, Dr. Amit. So this was the case with us. Yes, Dr. Tony. So I hope you have seen that case, and he has beautifully written. I told him to write the summary of the case so that I can discuss the case today, and he was very obliging, and he wrote the whole history. And every day he keeps basically WhatsApping me how is the case of the patient. For example, today also he just WhatsApped me, and he told that the patient is much better if I have the So today also he WhatsApped me, and he wrote that he is feeling much better today. On Instagram also, both. So this was the case. Anybody? So we have a remedy from Dr. Vishal Sepia. Dr. Alexander, welcome. Good morning. Not read the case, Dr. Vishaka. It was a beautiful case. It was a beautiful, Dr. Kochu, welcome. It was a beautiful case. You go and again read that case, and the remedy prescribed was very simple. The patient, bryonia. Okay. So we have remedies, bryonia, sepia. Remember, the doctor had prescribed him augmentin 625 milligram. Just wait, Dr. I'm just discussing the case. Augmentin 625 milligrams thrice a day for 5 days. He took only for the first day, and we stopped the antibiotic because I was very sure about the prescription. Now, this is what basically I always want to teach to my students who come to me, that when you're very sure about your prescription, make sure that you stop everything, because homeopathy can work very well in those cases. If you go further and see that case, I did not give bryonia, nor did I give sepia. Anything else that comes to your mind? Remember, we were basically treating a case of septic arthritis. Yeah, Dr. Maya Wagmare, welcome. Dr. Avantika, welcome. They were on Instagram. So we wanted a remedy for a septic arthritis, and there was a slight swelling in the knee because there was a slight hematoma. And it was basically, one day suddenly the knee swelling started. Very lovey-dovey type of girl, only has one friend, and she loves cycling, she loves traveling out, she loves to eat pizza, burger. That was the only symptom we actually had from that case. But then, as the case progressed, I just gave that way. Good evening, Dr. Pamala. I'm sorry, I don't know the name. So which remedy? Why bryonia? Bryonia, of course, it's a very important remedy, but not bryonia. Anything else? We have one. Yeah, good afternoon. on Instagram. Why bryonia? Why sepia? Anybody? If you answer fast, I'll be able to answer you the question very fast. It was a fantastic case, and the child said one thing and Tim Crude no. So this was the case. I gave just 2 doses of sulfur. No, not sulfur. See, if you have seen my YouTube video of Moxol, I have written few entry points of Moxol where you have to see how Moxol develops. It is not only Moxol, a very anger, elements from anger, indignation, mortification, humiliation. It is always there. But elements from ambitious, deceived, elements from disappointment, and elements from being alone is the entry point of Moxol. So this is how I'm basically trying to tell you in YouTube whatever I have seen in my clinical practice. In this case, one symptom of that remedy was so important. I took the symptom anguish when alone. She just could not stay alone. She used to feel very angry and lot of that, because her brother was born after 9 years of marriage. Now she's 9 years. The brother is born now. That's why the mother always keeps that child, because she has to feed the child. And this poor girl, she has to go out, and she used to feel so angry, so hurt, and there was a lot of mental pain. And that was the entry point of my case. So you needed a remedy in Sora, which is good, lovey-dovey, lovable child. But in syphilis, psychosyphilis, anguish when alone. And she used to feel so bad alone that mother does not love me. What a sibling rivalry we say. But that was the entry point which I got of the case. Good afternoon, Dr. Sachdeva. So can you tell me the remedy now? So it is so easy, Can you tell me the remedy now? This is what basically I had an entry point of the case. And when you enter with such a psychosyphilitic rubric, you know that you have given that remedy right. Can anybody tell me the remedy now? The remedy has so much anguish, so much mental pain, so much feeling of being hurt. But actually it is not, but she feels that way. And that's why left-sided swelling in the knee, septic arthritis, reactive arthritis, fever, taken a lot of treatment, but no change. Now, Dr. Tony says pulsatilla. So much anguish is not present in pulsatilla. We are treating a case. And believe me, we stopped the antibiotic in between. We should not do it. But I was so very sure that the remedy is right. So I did not want the interference of anything. And in the next day, the fever came down. The patient started reducing the fever. And he told me that, doctor, she is feeling very hungry. What to give? I said, just give her anything. And in 24 hours, the swelling went down. That is the remedy. Dr. Vishal says Stephisagri on Instagram. Dr. Amit says Lacan, anguish. Lacan has something more. See, entry points. If you see my elements from in Merck in YouTube, you will find something very different, Gastric ulcer का क्योर कर सकते डॉक्टर मुबीन हो सकता है. This is, and the remedy which I gave, a simple remedy. I'll not waste much of the time. I gave the patient a single dose of phosphorus 200. And I knew that the remedy was absolutely right, because this is a psychosyphilitic rubric. Of course, then I added few other rubrics of phosphorus, but this is how I entered the case. And she had become very, very irritable, very, very irritable. And after in the night after eating dinner, she had become very irritable. Did not want to eat the dinner because she always felt that anguish. So if you've seen phosphorus also, the patient has irritability before dinner. That is also phosphorus. And now she had become so mischievous that she used to hide the mother's medicines and the child's medicines, so that the mother gives attention to the child. So there was mischievous, playing tricks with the elders. That is also phosphorus. So this is how phosphorus 200 and the patient is cured within 24 hours, which 1 year she's not able to get the results. You have seen the case on my WhatsApp group. I hope you have seen it. It's a beautiful description of that little girl, psoric phase, the psychotic phase, and the syphilitic phase. Welcome, Dr. Vinash, Dr. Saili. So this is what, yeah, Dr. Mira has Cilicia, Aurum, and Mercury. Yes, that's also on my YouTube. So this is the importance of phosphorus. Every time, don't think that one particular angle of phosphorus, that phosphorus patient is good and beautiful with narrow chest, you will get or you will not get. But believe me one thing, whenever you are prescribing phosphorus, in lot many of cases, I have seen like this, phosphorus doing like this. What is this? This is how you have to see phosphorus in your OPD. When you go for a visit, you have to see that. What is this? I'll tell you something very beautiful things about phosphorus, Yes, anybody? A phosphorus patient, just like this. And immediately, don't take it as tics or gestures. This is a typical symptom of phosphorus. In so many cases I have seen, phosphorus doing this symptom. What is this called as? Anybody? Anybody? Dr. Pandey has joined, Dr. Burhani has joined, Dr. Ajmer has joined on Instagram. Anybody, have you ever seen this type of symptom? Disapproval. No, this is not disapproval. This is, I am just telling you the symptom which I have seen in my practice. Sometimes just one symptom and you get the remedy. This is snoring. No, this is not snoring. This is like this. This is how the phosphorus patient will, sometimes you see in a phosphorus patient, and this is a typical symptom of phosphorus. Such beautiful symptomatology is written in the Mater Medica. If you get some time to read, keep on reading Mater Medica every day, and you will be surprised that there are so many symptoms which the patient does in front of us. Actually, it is a symptom, but because we have not read, we cannot basically understand what the patient is doing. So before I tell you something, let's take one question. I'm a patient. My question is, after a heart stent placement, can we... No, it is not Tiger's voice. Can we switch to homeopathic treatment, discontinue allopathy? Is it possible? See, when you have done stenting, there has to be a cause. If you are on which type of medicines. In my practice clinically, I have seen, I had a case just last month only. He had done stenting and I was treating him. Every medicine we could stop. Even he was taking telmisartan 80 mg. Now we have reduced to 20 mg. Now we have reduced to 20 mg because the BP is going down. It has come to normal. So the doctor is also surprised. Rest, you can stop aspirin, you can stop statins, you can stop everything. But when you are stopping the blood pressure medicine, if the patient on blood pressure medicine, make sure that his BP starts coming down with your medicine, and then start tapering the medicine. Don't stop suddenly the antihypertensive medicine, because that would create some other side effects in the body. If your medicine is acting, then gradually start to taper off the dose. Welcome, Dr. Awad, Dr. Prajapati, Dr. Borkar, Dr. Sachdeva. What this sound is called in phosphorus? That was my question, Dr. Sachdeva. It is such, if you try to read Mater Medica every day, when I teach Mater Medica to students, now I'm teaching in 2 colleges and I'm teaching to my students. It is such a beautiful thing. You learn every day something, This symptom is a very, very important symptom of phosphorus. I have seen this symptom at home visits also and in my chamber also. Good afternoon, Dr. Navjot. What this is called as, this is called as snarls like a dog. SNRLES. Snarls like a dog. This is a very, very important symptom, a clinical symptom that everybody should remember about phosphorus. I'm not going to tell you some routine symptoms of phosphorus because you already know. I'm here to tell you something which is not there and I have seen in my practice behind what is there in phosphorus. That's why the case explained to you of that reactive arthritis or septic arthritis, I have forwarded in all the groups because of the beautiful result within 24 hours, not even 24 hours. It is called as snarls like a dog, SNARLS. Okay, I hope you understood, Dr. Sunita. One question on Instagram, sir, molluscum contagiosum case, there is no itching, no redness. On what basis we go through the case? Of course, no, Dr. Sachdeva, only one medicines I have seen in my practice clinically and basically applied in my practice. So I've used phosphorus only in my practice. So I can only tell something about phosphorus. Other remedies I don't know. Molluscum contagiosum, if there are no symptoms, if there are no symptoms, basically, you must think about remedies like thuja, remedies like silicia. Okay. And see, one thing everybody should understand one thing, whatever is there. If you are using a repertory of version maybe 95, 96 or 2000, and now you are using a version of repertory which is of 2020. So for example, a rubric abrupt, in the basic repertory there are 19 remedies, but now there are about 50 remedies. Maybe after 10 years it will have about 80 remedies. So you put a rubric and every remedy will come in the rubric. So it depends upon what edition you are using of that repertory. If I'm using a repertory which I maybe bought in 1995 of complete repertory, now that repertory of 2020 will be a vast difference. One rubric may be positive, will have about 10 remedies before in 20 years back, and now it may have 50 remedies. So that depends on which repertory, which version of the repertory you are using. I'm getting good results what I loaded my repertory, complete repertory in 1995. That's why in that repertory, only one remedy, snarls like a dog, is a beautiful remedy, phosphorus. This also you have to take in account when you're prescribing and reading the repertory. Dr. Shruti, welcome. Dr. Razik, welcome. The urticaria from pressure causes itching. I think urticaria is, a problematic, because in every YouTube live, I have some questions on urticaria. Now, see, basically what happens, either it is urticaria or basically it leaves marks on the skin. It is something different, that you apply pressure on the skin and there is marks on the skin. It is beautifully written in Mux Solo Bovista. But if you see pressure, now see, if you prescribing only for that symptom, pressure symptoms, you can definitely use these remedies, Muxol or Bovista or Rustox or Arctic urines. But for me, two remedies are very, very important, and that is Muxol and Bovista. Yeah, sir, one question on Instagram, sir, is 200 potency thuja 3 doses is enough for case to cure? You start, if you have Dr. LM potency, start from LM potency rather than thuja. If you have 200 potency, start LM. If you don't have LM, give at least 30 potency first, and then if you don't get the result, then you can say 200 potency. Sir, for decreasing uric acid therapeutic, explain. No. See, uric acid is accumulation of uric acid in the bones. So explanation would be, it is basically a condition of psychotic condition. You can use benzoic acid, you can use other remedies or colchicum, but it will give temporary relief. But if you want to cure that complaint, it is a psychotic phase, so you have to take a case taking and find out the psychotic symptoms in the patient or psychoseverity in the patient, and then prescribe rather than only prescribing for uric acid. You can prescribe colchicum, you can prescribe ledampal, you can prescribe benzoic acid. They give good results. But in some case, it would be cure if the symptom matches, but in rest case, it would only relieve the symptom, not cure the case. So make sure that you take the whole case. Sir, is online consultation available? Yes, it is available. Dr. Pampala, sorry, I cannot pronounce the name properly. If I am mistaken, thank you. So Dr. Pandey says, sir, for cough aggravation and entering in AC room, his problem from 2 weeks. Rumex will work for some cases. Remember one thing, Dr. Pandey. Your chamber is AC, but your outside is not AC. So when the patient enters from warm to cold, phosphorus, from cold to warm, bryonia. Very simple. Dr. Sonali, welcome. Dr. Anjas Smith is on Instagram also. Sir, administration no sod, how many doses you prescribe a single dose or repetition thrice? No. Whenever I prescribe a no sod, Dr. Amit, I prescribe single dose. And if you have read simple Allen's keynote, I think I've told you before also, I think. It is beautifully written in Allen's keynote that don't prescribe nosode as nosode. Nosode is also a remedy and it can be sometimes as a constitutional remedy. So don't think I have to open the case with nosode or it not like that. It is as good as a constitutional remedy provided that remedy should fit your case. It's a simillimum. So for if you ask me, basically nosode is a remedy which has to be given after a perfect case taking. See, if you have read Allen's keynote, I think it is given in Sorainum. If you open Sorainum, I think before relationship it is written that Sorinum should not be given for Sora or psoriatic diathesis. But open Allen's keynote. But like every other remedy, upon a strict individualization, the totality of symptoms, and then we realize its wonderful effect. Dr. Amit, do remember this remedy. Like every other remedies, upon a strict individualization. That is so important to know, That is homeopathy. One more question on Instagram. Sir, there is eczema, mainly rainy season, arsenic and rust stocks are given. First case seems to be cured, then it continues. How do we approach the case? See, whenever you have rainy season, normally we prescribe either rust stocks or arsenic album or dulcamara or natrum sulph also. If you are basically prescribing to relieve the complaints. But if you are prescribing for constitutional medicine, then it is basically, we want remedies basically who have the symptoms which are aggravated in rainy season. So take the whole case and then go basically, rather than giving either dulcamara or natrum sulph, arsenic, rust stocks. One remedy you should add in this case, if rust stocks does not work, try to think about rust ven. It is also a very important remedy in this case. Welcome, Dr. Trivedi, on Insta. Sir, when to use 3, 6, and 12? That depends on the reactivity. It is said that whenever there is a lot of gross pathology, then you must use low potency. So when you can use 3, 6, 12 when there is gross pathology involved. What is your experience with radium brome? See, whatever experiences I have of radium brome. Now, whenever radium brome is prescribed, what basically we were taught in our college was that whenever there is radiation and whenever the symptoms are after radiation, you can think about this remedy. But let me tell you, only limiting that radium brome to be to that would be a insult to radium brome. Radium brome basically, if you ask me radium brome, it has a very important symptom. In fact, if you have asked me, I'll just tell you one symptom of radium brome which I had cured a case of this arthritis, a case of a chronic arthritis. Chronic rheumatic arthritis is a very important symptom of radium brome which I have seen in my practice. First, radium brome has one of the very important symptoms which is related to back symptoms and extremity symptom. Radium brome has severe pain in all the joints, especially the knees and the ankles. And in radium brome, the arms feel very heavy and there is a lot of cracking in the shoulders. That is a very important symptom of radium brome. Now, most of us use radium brome basically in skin complaints. So I'll just add something about skin complaints. Radium brome has a very important symptom. Itching, there is so much itching in radium brome. It is said that in radium brome the itching is so much, there is burning of the skin as if like fire. There is burning of the skin as if like fire. That is radium brome, and that's why it's a very important remedy for dermatitis when there's itching, burning, swelling, and redness. A lot of the times you think about epismel, you think about sulfur, and it does not work. That's a symptom of radium brome. It has swelling also, it has burning also, it has redness also, it has itching also. That's a symptom of radium brome. Whatever I can recall my mater medica, And radium brome, like Merxol, has metallic taste in the mouth. That is also a very important symptom of radium brome. So these are basically, and one symptom, it is said that whenever ulcers are due to radium burn, and it takes long time to heal, think about radium brome. This is what Dr. Alexandra, whatever knowledge of mater medica is still left in my grey matter, that's what I could share with you. In rheumatism, patient with motion knees increases but stiffness of the ligament decreases. With exercise, with swelling, with feeling of dryness of the thighs, what will symptom? Rustox or bryonia? No. I will not give Rustox also and bryonia. Think about other remedies. Think about causticum. Think about guaicum. Think about stiffness. No, think about phytolacca also. Okay, but causticum comes first. Okay, so one more question on Instagram. Oh, welcome, Dr. Trivedi. Give permanent. Sir, give permanent cure for allergy, graphitis, and migraine. Give permanent cure for allergy and yeah, we can cure that. My experience on psoriasis, Dr. Bro, I had given an interview. I was interviewed by Dr. Anam Zahir on Instagram. So you can share me your number. I'll send you that link. 1 hour I spoke on psoriasis. And whatever reviews I have got hundreds of reviews that they liked my talk on psoriasis. So if you WhatsApp me your WhatsApp number, I'll be able to share that link with you. Do hear that. I have tried to share my experience of psoriasis with that. Left ankle, small fracture and swelling at home, give arnica. How can we start Ruta 01? Is it female? See, there's small fracture and swelling. So repeat arnica 30, 3 times a day, at least for 3 days. And then why you want to shift to Ruta? Shift to arnica LM potency, give arnica LM, start with arnica LM5, LM6. Don't give Ruta. It is classical case of fracture, Okay. Case of donkey has cured. Okay. Dr. Alexandra, I would like to tell you, I just cured one case of cancer of dog, with I think I shared that on the Facebook also. A beautiful cure. I just remembered you because you are dealing a lot with the animals and horses, I know. One question on Instagram. Sir, please suggest remedy for stitching pain in arch of foot while raising from prolonged sitting. You can think about valeriana, think about Arenia diadana, think about Ledampal, think about calcarea floor and Ruta. Sir, tinea versicolais, there is no specific symptom. See, tinea versicolais, basically it's because of the low immunity, you have to take the whole case. Or you can give Teucrium or Indica or Echinacea. But whole case is important because immunity goes down and the fungus and the virus comes in the body. So take the whole case and go for the cure. So please speak on scope of homeopathy in ligament tear. Wonderful. I had a beautiful case of ligament tear of a student of MBBS, and the doctor said that you need to operate. I started with Belisper, LM potency. I started directly with 0809. He was much better, and intercurrently I gave weekly twice dose of Ruta 200 with exercise. Believe me, in 1 month's time, that doctor, a final year student, started walking normally and is absolutely normal. The ligament has been cured. This is the scope of homeopathy in this condition. One more patient felt much better after using your COVID nosode. Obliged. Dr. Vishal, thank you, and thank you for sharing your experience, because it really gives me that, that kick to do something for the pathy. Because COVID-19 cases in my now in my 6 months of practice, I have seen so many cases of AVN, of coronary artery blocks and diabetes mellitus, because skin is not coming behind. It is very painful. So I asked the patient to operate. But before that, if the foreskin is painful but it is bearable, take it from me, you can start calendula LM potency in repetition. I started calendula 05 3 times a day, 06 3 times a day, and the patient is much better. And if the pus discharge comes, just tell the patient to take a swab and do dressing with calendula Q. It will give good results. Okay. Dr. Fatima from Homeo Clinic has joined on Instagram. Dr. Pandey, patient on allopathy medication for hypothyroidism and taking homeopathy medicine like 1M, potency for fatty liver by renal calculus. So we need to give thyroidinum as intercurrent? No, it is not a law to give thyroid. If your remedy is right, it will work. There's no need. Welcome, Dr. Fatima. Sir, for black pigment around the neck, can I use arsenic calcareca? See, Dr. Bro, black pigment around the neck, basically you have to understand why there is black pigmentation. That is called as acanthosis, and it is because of the family history of diabetes in the third generation. Means if he has got diabetes, so his father's father must have severe diabetes, that's why he's got acanthosis. So if you take that case, do take that case properly, and the family history is very important in this case. Okay, and that can be cured. I have not seen very specific arsenic or calcareca work for the case. It is basically constitutional. Left-sided weakness of hand and legs. Patient is hypertensive, diabetic, weeping disposition, irritable. See, the patient is diabetic, the patient has weakness. If you study this chapter of medicines of diabetes and hypertension, you will feel when a case of diabetes in front of you, he has many of symptoms. We are treating that symptom, but basically it is symptom of diabetes in that case. In this also, I feel the weakness maybe because of diabetes or hypertension. So the root cause is diabetes, hypertension. So if you can control that diabetes and hypertension with your medicines, automatically the weakness will go. I have not seen cases where we give maybe tonics, it will get relief. No, lot of orthodox school medicines try to give lecithin or ferrum phos or B12 so the weakness goes, but it does not go because the basic underlying cause, diabetes and hypertension, might cause this type of problems. Treatment of phimosis grade 3 required. I told you, give calendula, LM potency and repetition, and try to there is exercise of foreskin, keep it taking back and front, apply moisturizing cream, and there is pus discharge or some discharge, apply calendula, mother tincture on cotton so the infection does not spread, and in that case you will get very good results. It's already 3:30, half an hour has passed. Few questions more. I hope everybody understood something about phosphorus. See, I'll keep posting what are the results of that remedy in my future in the WhatsApp also, but see how the remedy works if it is a very right prescription. How important is miasmatic prescription? It is the most important thing, no? Everything starts from that only. So miasm knowledge is very, very important in case taking. If a syphilitic case comes to you, automatically you have to make sure that you take syphilitic symptom for prescription. It is the basics of homeopathy is miasm, Sir, please suggest experience of fibromyalgia. Fibromyalgia, I have seen in most of the cases, it is because of some mental element, some depressive thoughts, where the patient is not able to express, and he always stays inside, always fearful, and there's a lot of pain in the nerves and the muscles. That's the basic cause in cases which I've cured of fibromyalgia. This is the cause of fibromyalgia. No, if you want to do circumcision, do the whole circumcision. Why partial? Before that, give calendula, LM potency and dressing and some exercise of foreskin, and you should get results. Welcome, Dr. Pramod Ingle on Instagram. And this is how I took the very nice, Dr. Anja. And this is how I have got results in fibromyalgia. That's why I always say that whatever clinical experience I have, I'm sharing you. People might have different experience, but whatever cases I've cured of fibromyalgia, this is the entry point I've taken, and I've got beautiful results. So I think that's all for the day. It's already half an hour past. Do read about the case of phosphorus, and we'll keep discussing that in my future YouTube videos or on my WhatsApp. So thank you all for joining. Thank you for your time. Until next time, goodbye.